Okay, so this is a super common source of confusion, especially when I'm fielding questions from the ED or from medicine consulting services. So I wanted to make a quick video about it. What is the difference between a flap and a graft? They are both ways that we can potentially reconstruct wounds that are too big or too complicated to just close up directly with sutures. The main difference is that a flap has a blood supply and a graft does not. Grafts are typically used to treat superficial wounds that don't have any inside body stuff exposed. No bones, no nerves, no blood vessels, none of that. We basically just take like a super thin piece of skin, like what you would scrape off if you got a rug burn. We take that really thin piece of skin, we put it on the wound, and it stays alive via basically just diffusion from that raw surface of the wound. Usually it gets incorporated in about a week and you're done. A flap, on the other hand, has its own blood supply. It's a bigger, thicker chunk of tissue that we use either to treat really big, deep wounds or any wound that has like important inside body stuff exposed. And then there really are two different kinds of flaps that are important: local flaps and free flaps. A local flap is basically when we take a piece of tissue that is directly next to the wound, move it over to cover up the wound. So while it has its own blood supply, we never like fully disconnect it from the body and put it in somewhere else. We just kind of slide it over. A free flap, on the other hand, is a chunk of tissue that we fully disconnect from the body, from one part of the body, and then bring into the wound and rehook up. It's essentially like a transplant from yourself to yourself. So we're actually dissecting out the blood vessels that feed that tissue separately and then reconnecting them into a new location so that they'll stay alive. As with anything in medicine, first rule is do no harm. So the way we tend to think about grafts and flaps is that if it's a wound that we can treat with a graft, we'll always do that because that's easier, safer, quicker recovery. And then if a wound really needs a flap, we tend to prefer to treat it with a local flap if we can, rather than jumping to a free flap. We love to do free flaps, but it's a big surgery. It's a much bigger undertaking in most cases than a local flap or a graft. So we really reserve those for cases where there's not any other treatment options.